physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about knee pain. 3 different things you should try. And we're going to go over 3 different products, really, that may help you. You don't necessarily have to buy these, but we'll give you some other options, maybe. But let's start off. The first thing I really recommend when you have knee pain is you want to get some form of movement. Consistent movement without weight bearing. So walking is fine, but you're weight bearing with walking. Running is fine, but you're weight bearing with walking.
Right.
So we're going to recommend trying to get the legs moving.
All right. The only thing, if you're watching this and you just had some trauma to your knee, like you fell on it really hard, and then maybe you need to wait before you get it moving. But we're talking about...
Yeah, if you have a fracture, you're going to want to wait. But even really in that type of injury, Brad, you really want to get it moving as soon as you can.
Sure,
The more you get blood flow to it, the more it's going to heal. You can simply do these.
Yep. Some simple, non-weight bearing, non-aggressive, get it moving.
But we have the FitGlide and the FitGlide. The FitGlide is a little more geared towards one leg, obviously, and it's really geared maybe towards... like if you had a knee replacement.
Sure, right.
Because you got to get the knee moving after that. So it's just one-sided. The advantage of like the FitGlide and the FitGlide is that, one, you can go flat, you can go on stand forward, on the stand reverse. But one of the big advantages is you can do it in bed. And we'll show that. We'll show it now.
Right. Yeah, and I think I want to mention too, Bob, you mentioned using it after surgery, but if you know you're going to have a knee replacement, it's wonderful to use it before surgery to prepare yourself.
Absolutely.
Prehab, we call that.
Right. Do you mind getting off the bed, Brad?
Oh, gosh.
I'm going to go ahead.
I'm sorry, I didn't
maybe set up
realize
one for
I
me.
was hampering progress here.
Well, would you set one up for me now?
Oh, yes, Bob. So we'll pretend this is a bed.
Right.
As opposed to a plinth. I'm going to put it on like this.
Okay. And this is something you cannot do in bed unless you have the FitGlide. You can't slide your heel very easily.
Yeah, it's
especially
difficult.
if you have a painful knee.
Gets hung up on the sheets. Yeah. And even if you have someone assisting you, it's much easier for the person assisting because you have to lift up the leg, clear the heel from the bed and lift, and it's hard on your back.
Now, you can use a towel on there if you don't want shoes in the bed.
Right. I mean, you can put your heel directly on there, but it's a lot more comfortable if you fold up a towel.
Brad, would you mind putting a towel in there once just
Sure. So
show?
It doesn't take much. You certainly don't want a big, thick towel, even just a hand towel, just to get a little cushion in there.
So that's going to be a lot more comfortable on the heel so it doesn't break down.
Exactly.
But we're going to also show the FitGlide here.
Sure.
This one works very well, too, if you have both legs giving you trouble and to keep both legs in good shape.
Yeah. So it's exact same thing, but it's for 2 feet, and it's obviously built as one unit.
Well, you can find myself here, and again, you can go, alternating then.
Right. And the nice thing, a lot of times people with a knee replacement, if one knee needs to be replaced, oftentimes the other one is arthritic too, and
it's on its way, probably.
Yeah.
So, again, if you're just having plain old knee pain, especially arthritis, it's a great thing to get the knee moving. You get more synovial fluid production, which is kind of the oil of the knee.
Right.
And that'll keep that joint lubricated. You're going to get more blood flow. You're going to help with swelling. It's just all those good things.
Right. And it's active, so it works those muscles, the hamstrings and quads, and helps keep those, strong as well.
So you can do it in a seated position also, and that's, we should mention too, Brad, these are really lightweight.
Right.
So if you are elderly, you can just pick it up with one finger.
Yeah. This one weighs 5 pounds.
5
this
pounds.
Is about 3 pounds. They're made to move around,
Right. So Brad and I both have the stand up in the front now, so that's working the quadricep a little more. So you can actually put leg weight on your heel cuff. What am I trying to say? A cuff weight on your heel, on your ankle.
Ankle weight, yeah.
Yeah, ankle weight. I'll get to it yet. but that'll actually provide a little resistance.
Right.
And then if you want to work hamstring more, flip it around. And this one is surprisingly a little bit difficult, isn't it, Brad, after a while?
It is, even with a completely healthy leg, and I work it this way.
And without weight.
Right.
even.
After a couple minutes, I can feel those hamstrings warming up, and they actually start to burn. So if you're a sedentary person or haven't done it, you probably will not want to start there. You'll want to start with it flat.
All right, Brad, let's move on to the book here. We've done a lot of videos based on Robin McKenzie and his techniques of treating your own knee.
Right.
And this just really summarizes it. It's written for the layperson.
Right.
It's like $10. What is it? Only 50 some pages? No, I'm wrong. 88 pages, and it'll lay it right out for you.
Right.
What you should do.
Robin McKenzie is a therapist. He's been around he's passed away now, but his whole philosophy for therapy was to educate the patient to take care of themselves so that they can
They
manage.
take ownership of it.
Right. Yeah, and you have much better success typically when you understand the symptom and you can self-treat.
Right. So if you go to our channel, Bob and Brad, which you may be on right now, you'll find that we have a lot of videos on this, and you
Right.
could start with that. But this just provides a really good summary.
Right. Mhm.
So, all right, the last product we're going to talk about is surprising to a lot of people. But when you have a knee pain, you want to actually make sure the muscles around the knee are loosened up really well.
Correct.
And supple. And so one great thing to use is a foam roller. And there's been a little bit of a shortage of foam rollers in some retail sites. So this one is available on OPTP.
Okay.
But it's the Axis roller. This one's a little bit firmer, isn't it?
All right. It's not the black one is the firmest. This
Yeah.
one's kind of a
Gives a little bit.
yeah, it gives a little bit. It's 6 inches in diameter, 36 inches long. They have some that are different lengths, but
And these are less expensive, generally,
then what?
than like the really rubber ones. And
Oh
stuff like
yeah,
that.
right. Then the
Yeah.
softer ones that are
Right.
more cushion. I like the softer ones for like my back and things like that.
Sure.
For these muscles, probably
Yeah,
a little
you
bigger.
can get
a little more
aggressive with these.
aggressive.
So we want to hit the quadricep, hamstring, and calf because
Sure.
all those muscles cross the knee.
Yep.
So you want to show the
Yeah, are we going to
Hamstring.
do it up on
Sure.
on here? Okay. Typically, you don't want to use this on a bed. It's
Yeah.
soft. You can try it, and if you got a firm bed, it may work. But on a carpeted floor, it rolls a little easier. So, like Bob is talking about, you're working the calf muscles. We want to keep those from getting tight, which typically, uncommon for those to be tight. And you can work it like this. I'm doing both legs at the same time. I'm putting my hands down on the floor.
lifting his butt up.
Yep, a little bit, and just roll back and forth. The more weight you put on it, the more aggressive. If you're doing this and you get used to it and you want to get more aggressive, you can cross. So now my right leg is getting much more pressure.
This changes it. I mean, this really adds a lot of pressure to it.
And you may want to rotate your toe out, and that gets the side muscles, lateral muscles, if you will,
Yeah.
on the side. You're going to
Very
work
good.
that.
Good
You can
idea to do it.
turn your toes this way.
You want to do hamstring, and I could do
Sure.
the quadricep
Yep.
then.
And then it is nice just to roll it right up to here. You might as well finish that. And you may work that for a minute or two, up to 5 minutes, depending on what you'd like to
What's
do.
nice about it is that you can do these fairly quickly because you
Right.
can do both at the same time, unless you're trying to focus on a painful area.
Right. It is important with the hamstrings that you can work it around the knee. That's what we're working. But you still want to get
Yeah,
in the
all the
belly
way through it.
and all the way up to the ischial tube or that sit bone, the butt there, because oftentimes it's tight up there.
Yes.
And you just want to get that muscle to relax so that it helps with the knee.
Just want to help off, Brad.
Yeah.
So
I gotta
I
rest.
just saw two recent friends who had knee pain,
Sure.
and both of them had really tight quads.
Sure.
So I'm having them stretch their quads, but this is actually better even than stretching them because you can hit the tender spots end of the quad as opposed to just stretching the whole quad.
Sure.
Now I'm lifting up here. Now you can actually cross over like this and hit one quad this way too.
So now his left quad is getting the more aggressive.
The brunt of it.
Yep, pretty much
So,
all of it.
I do this every morning, so I'm pretty well
Right.
versed. It doesn't give me too much pain.
You do yours on the floor, I'm assuming?
I do mine on the floor, yes, and I actually have a really aggressive foam roller.
Oh, yeah, you got the one with bumps on
Bumps
it.
on it, yeah, bumps, and really hard, and
But,
so.
and you do it, and you've been doing it for a while. So
Right.
after you learn how to use it and your body adapts to it, that's when you may want to go aggressive.
No, when I started, I had to use something like this.
Right.
So, all right, that's it. Give those things a try, and we'll see if we can knock your knee pain down.
That's right. Keep those muscles loose.